Morning, everyone. My name's Jen Davis, and my pronouns are she, her. And it's an absolute honor to talk to you today. Thank you so much for this fund to fund this work that I'm going to present to you. And yes, I'm really excited to share with you today our work. So our study is called the ACEs LGBTQ plus study, and essentially we're looking at the acceptability of self-sampling for cervical screening within this community. But specifically today, I'm going to talk to you and share the voices of those that I spoke to from the transgender and non-binary communities within the UK. Great. So I have no disclosures. So cervical screening saves lives. We know that. However, unfortunately, cervical screening, the rates of cervical screening are decreasing, unfortunately. And within the UK, despite free point of care screening that is readily available to everyone, unfortunately, 1 in 3 will not attend, which is a real big issue. And the main reasons for this are access, but also the speculum examination, the dreaded speculum examination, which causes embarrassment and also discomfort and pain for some individuals. And of course, it represents a health inequity for a lot of individuals, and it does represent a health inequity within the LGBTQ plus community, which is why we were interested in kind of accessing that voice and seeing what they thought. So in terms of breaking down barriers, one of the big things that's sort of currently very exciting within the field of screening is self-sampling. And we know that a big part of the world are now using vaginal sampling as a way of detecting HPV and hopefully precancer to treat. Self-sampling is really acceptable and also appears to perform as well as a cervical sample taken with a speculum. In the UK, we've been a little reluctant to roll this out. So we are awaiting with bated breath some studies that are going to give us some information, and hopefully we'll be able to look at an implementation study to try and get self-sampling into the screening program. However, vaginal sampling doesn't address all barriers, it seems, and urine is another way of detecting HPV for cervical screening. And our group in Manchester has been very interested in this, and I've collected a lot of urine over the last 3 years from individuals. And essentially, what we found is it's super acceptable, as you would imagine. It's a urine sample, but we need the test accuracy to be good, and what we found and groups across the world have found is that you require the very first part of the urine flow, and that can be collected with this incredible device called the Colli-P. And this device collects the first part of the urine reliably and mixes it with a preservative, which stabilizes the DNA for testing. So it's super acceptable. And if you use this method, it shows really promising test accuracy by comparison to cervical samples. And that's how it works. You see there's an overflow chute, which means that you can do your whole urination through it. So hopefully no urine on the fingers, which we all know is a problem. So within just very quickly, the results we have are, so in terms of HPV testing of urine with this device, we found a relative sensitivity. So that's how good the test is at detecting those with high grade precancer, which are the people that we really want to find and treat. It showed a relative sensitivity of 0.92 by comparison to a cervix sample. And also we've recently done a big study within the general screening population and found a relative specificity. So how good is a negative test? Like how much can we believe it? Of 0.97, which is excellent as well. And this is all tested on platforms which are designed for cervix samples. So we certainly need to probably change the way that we test urine by comparison to cervix. So really exciting, and watch this step. But today I'm talking about the LGBTQ plus community, and I was really interested in asking the thoughts of this community around self-sampling methods, and really to shape an inclusive future for cervical screening within the UK. So the first study was a survey, and it was co-created with members of the community, as well as all these incredible groups within the UK that advocate for this community. We disseminated via Twitter and had 503 completed responses, which is incredible. And as you can see, a wide geography across the UK, sexual identity, ages, but also almost half were transgender or non-binary, which is amazing and shows how important this is to this community. And what's really interesting is if the individuals that identified as transgender or non-binary, in terms of their actually what puts them off screening, we've talked about the universal barriers, and certainly they do as well, but also they have the additional barriers of having gendered surroundings, so surroundings that are pink or talking about women, being misgendered, fear of judgment from healthcare staff, and lack of inclusive language. So this was something that I wanted to delve a little bit deeper in. What would have helped people to go for attend screening, self-sampling, luckily, because I've devoted a few years of my life to it now, and also being offered a smaller speculum or being able to try self-insertion of speculum. So things to think about in terms of giving control back to the individual. And in terms of preference, you can see here that if we look at everyone, because we looked at the whole community, you see that self-sampling is very popular, but still 1 in 5 would have a speculum-based sample. Um, but in the transgender community, actually half wanted urine and a lot less would have gone for a speculum examination. So this is really important work for this community. So the main barriers were provider and procedure related, embarrassment, discomfort, pain, but also not feeling acknowledged or welcome. And self-sampling was very acceptable, and urine specifically for the transgender community. So we had an amazing event. That's the team there. We curated it within the community and introduced all and shared all these results. So next, I wanted a bit of a deeper dive using qualitative methods, so interviews one-on-one, to get a little bit more information about the barriers, but also how self-sampling could help. And today I'm just going to talk to you about bring you the voices of the transgender and non-binary individuals. And I did 17 interviews in total. And of course, this work has been generously funded by the Dicey Scroggins Fund for Equity, Diversity and Inclusion. Thank you very much. Recruitment was interesting. So we put this on Twitter. Do you have a cervix? Obviously, it's really a way of specifically targeting people who do not identify as a woman. And unfortunately, well, I became famous overnight in the right-wing media in the UK, shall we say. And unfortunately, currently, the political situation is quite transphobic. And so, as a gynecologist, it was odd to be called to be told that I was negating women, but unfortunately, that is the current political climate. But what's really interesting is no advertisement is bad advertisement, because we then got about 60 more individuals within 24 hours that signed up for the study. So in terms of barriers, I'm thinking about system level, service level, individual factors. So we should break them down because that makes it easier. I'm going to talk a little bit about some of the barriers that came out, not all of them, and then about what self-sampling was thought of. So I'm going to read a few of these out. It's really difficult to cut quotes because it's like cutting someone's opinion. But when you're transgender, your gender marker can sometimes get changed. You can actually try for that not to happen. But unfortunately, sometimes it does. And if your gender marker changes, the archaic computer system within the UK, it is really archaic, and it's a real problem to change it, it seems, means that then if you become male, then you no longer get cervical screening invitations, which is a massive barrier, as you can imagine. So in my experience, the hardest thing is getting invited, because the GPs, without my consent, keep changing my NHS record from female to male, which means I don't get invited to things like cervical smears. It's complex. I don't understand. Some people seem to be able to opt in, some people don't. So it feels like there's disparity across the UK. And somebody's, very bold in saying it's very dangerous to change the marker, because, it's actually not fair to individuals. It's probably against the Gender Recognition Act. Interactions with staff, really some harrowing interactions came through the interviews. So one individual was talking about how how it's very normalized within, the nurse taking the smears, and so therefore that feeling that They probably do 20 of them a day or something, and it's routine for them. And I think that means that it switches you off a bit to how significant of a thing it might be in someone's life. Someone says, really horrible. Yeah, I don't think this was very, it's hard to, yeah, just bad. It made me want to interact. It made me not want to interact with that kind of GP office generally again. It put me off wanting to ever get screened again because I have no faith that they will be sensitive to my needs, that they will be sensitive to me, myself, my identity. Um, and just picking one more, which is interesting. So, in talking about interaction with healthcare practitioners, I don't think I'm weird. I just think, people go, oh, well, trans. That's kind of weird to look at or whatever. Yes, like I say, and it's novel, it's a novelty to come and look at this weirdo over here. So this was in response to a gynecological appointment, and lots of people being, asking if lots of people could be in the room, a student, etc., etc. So there's a lot of fear around cervical screening, which definitely came through. I've only had one, and it was after I started transitioning. So transitioning is transitioning from gender assigned at birth to current gender, and that often sort of involves also testosterone or hormones. I don't know. I think I was more worried about having to be exposed in that way, if that makes sense, especially as my body was changing and stuff like that. And then not really wanting somebody to have access to me. And also because I wasn't able to get a female. So interestingly, this individual had a male taking a smear, and that was quite difficult. I mean, there is a level of anxiety that comes with it. There's the anxiety of going to a place that is not expecting who looks like me to do that. Also, talking about taking hormones, testosterone, vaginal atrophy can occur and does occur, and that makes it a lot more difficult to have a speculum examination. And this individual says it turns out to be vaginal atrophy due to being on testosterone for not too long, being on testosterone without having any estrogen cream. It was really painful because I had such bad atrophy, and the nurse doing it was really unsympathetic to the fact it was causing me a lot of pain and was just like, well, if you want to be a man, you should be able to deal with this pain. So I don't see what the problem is. There were facilitating factors. So people advocating for individuals. This is probably true of everyone, but this individual said they did have another person there who was black and female, and I think that helped quite a bit. I think it made me feel safer because I was like, there's a person in the room who's not going to let me, hopefully, it's a lot of assumption, but who's not going to let me come to harm. LGBTQ plus specific services. So if we look at the purple one, put on an afternoon or an evening, like a dedicated session for people who identify under the umbrella, and that may help. So self-sampling methods, very positive, as you can imagine. So I guess it could be really great for people who don't have a good relationship with their nurses. I think at the minute, even among my friends, the number of people who do not go or put it off sort of thing is huge, that anything that improves this is going to be better. It's less interaction with healthcare workers, I think, and more privacy to yourself. They also talk about how it's like self-swabbing or testing for current sexually transmitted infections. So that makes it quite easy, a concept to understand. And vaginal self-sampling, again, somebody said it's a bit like a COVID test, isn't it? Which is how I describe it as well, but for the vagina. And there are some guys who wouldn't be comfortable, but personally, I don't mind. So I think there is that overwhelming feeling that having an option would be good. And urine, there might be some trans guys out there who are not uncomfortable about having a vagina and they would never want to put anything inside it. And so for them, it sounds like urine would be the best option. Some people have had very traumatic experiences and do not want anything penetrative whatsoever touching them. Therefore, peeing one would be better for them, and it's still 90% better than zero. So, yes, it's a good option. So, conclusions are barriers are multifactorial and complex. Hopefully, I've shared some of those with you today and the stories of the individuals who shared their time and stories with me. The transgender non-binary communities face numerous and complex barriers that require an intersectional and person-centered approach. At home, self-sampling, especially urine, could be a game changer and hopefully address these barriers, increase screening participation, reduce health inequity within the community, and improve user experience. We are, in fact, it's a UK-based study offering the choice for individuals who are overdue screening to have a pack in the post to do a urine or a vaginal sample. You're very welcome to take my email, and if you have individuals or a group or people who may want that offer of self-sampling as part of a research project within the UK, then I'm happy to communicate about that. We've got a lot of other studies. This is the brilliant team. And that's a cake I made with a collie pea. So thank you so much to everyone and everybody who's helped with this research and of course for the funding.